the scourge of mankind, chronic cardiovascular and kidney diseases, are losing their terror. The timely, individualized medication setting of the proteome analysis makes it possible. For the first time, proteome analysis can define and detect all proteins involved in cellular disease changes in a single analysis process, and therefore for the first time provide efficient and effective treatment at an early stage, before organ damage occurs. Hardly any patients with cardiovascular and kidney diseases have all the proteins that comprise the disease spectrum. For example, cardiac insufficiency. This varies from person to person. In some people, there are significantly more proteins affected. In others, only slightly fewer. As drugs only affect a few parts of the overall disease-specific proteins and also act differently, these proteins must also be affected and decisive for the disease. If they are not or only partially affected, the drug is only partially or not at all effective. This is the current dilemma in everyday medical practice. The efficacy prognosis of proteome analysis puts an end to this inadequacy. Hundreds of millions of people worldwide suffer heart attacks and other serious consequences in Western countries. As of today, completely unnecessary. Patients suffering from high blood pressure and diabetics are particularly affected. The drugs used to correctly adjust blood pressure and blood sugar levels have very different individual effects on cardiovascular and kidney diseases. For example, while two different drugs both reduce the blood pressure of an individual patient equally well, one drug reduces the individual progression of heart muscle weakness, while the other drug has no effect, but may cause unnecessary side effects and partially suppresses the effect of the other drug against heart muscle weakness. But even the effective medication for heart failure is not given enough in this way to slow down the progression. Where is the knowledge supposed to come from, without concrete and timely detection through proteome analysis? Only the timely application of proteome analysis makes it possible to determine which drug and dosage should be given to the individual patient affected in different ways. It makes it possible to combine the necessary complex scientific and analytical knowledge of disease progression and influencing medications in a symbiosis. This makes it possible to heal or at least prevent massive organ damage, which is currently only used to recognize chronic diseases. Thanks to the more than 1,200 renowned doctors and scientists who have developed proteome analysis. The key to your health.